Chapter 11, Diet and Health. There are a few important concepts in this chapter that I want you to understand. But let's start with reviewing the top diet-related causes of death in the U.S. Diet plays a role in 4 of the top 6 causes of death in the U.S. Heart disease, cancer, stroke, and diabetes. Most people are concerned about terrorism, bear attacks, or shark attacks, but the reality is deaths from cardiovascular disease are the biggest killer in the United States. The most recent statistics from the American Heart Association are that 79,400,000 Americans have at least one form of cardiovascular disease. That's 25% of our country. In 2004, 871,500 lives were claimed to cardiovascular disease, 1 out of every 3 deaths in the U.S. Only about 2 deaths a year are due to bear attacks or shark attacks. If you live in the U.S., you have about a 1 in 9.3 million chance of dying from a terrorist attack. I know it's difficult to think about death from a chronic disease when you are young, but the threat is real, and now is the time to start thinking about it. The good news is, your diet and lifestyle are big factors in determining your risk for heart disease. Let's look at this chart. It's in your book and also seen here. It shows the diet and lifestyle risk factors associated with different diseases. Let's look at cancer. We can see that a diet high in saturated fat, excess alcohol intake, low complex carbohydrate intake, low vitamin and mineral intake, and high intakes of salty foods increases your risk of cancer. Now I want to point out an important concept here. These food choices do not cause cancer. They are risk factors for cancer. They are associated with the development of cancer. Correlation does not equal causation. You don't just keel over and die after eating a meal high in saturated fat. Another important point is knowing the difference between risk factor for developing a disease and the risk of having the disease. For example, eating an atherogenic diet is a risk factor for developing heart disease. The risk of having heart disease is suffering a myocardial infarction, commonly known as a heart attack. I spend a lot of time in this class talking about cardiovascular diseases. With 1 out of every 3 deaths in the U.S. due to cardiovascular diseases, I think it's reasonable to spend a little time on it. For starters, cardiovascular disease is a general term applying to any disease of the heart and/or blood vessels, but most forms of cardiovascular disease are due to atherosclerosis. Atherosclerosis is generally thought of as plaque buildup in the artery walls, but it is in fact a complex inflammatory process. It's also important to realize that atherosclerosis doesn't correlate only with heart disease. Narrowing of the arteries will affect flow to the brain, the heart, and the lower extremities. This is why atherosclerosis is a major risk factor for stroke and for infections and gangrene in the feet and legs. Heart disease, stroke, and peripheral vascular disease are all a result of atherosclerosis. Hypertension is the medical term for high blood pressure. I don't expect you to understand the complex physiology behind hypertension from reading a few pages. But what I do want you to know is that hypertension is high pressure within the arteries. There are many factors, but important factors are increases in volume and hardening or narrowing of the arteries. Although sodium is the most commonly associated dietary risk factor for hypertension, it's important to realize that the DASH diet lowers blood pressure more than a low sodium diet alone. And lastly, let's move on to cancer, the second leading cause of death in the U.S. I think it's important to know that cancer is not a single disease, but a group of related diseases, which result from cells multiplying and disrupting normal organ function. I'm going to go through this step by step. It's also in your book and in the notes. Let's start with exposure to a carcinogen. I'm going to use tobacco because it's the most well-known carcinogen. In step 2, the carcinogen causes damage to the DNA cells. After the damage occurs, the cell has changed. The DNA is different. Step 3 shows the cells starting to multiply, but these are different cells. The cells have had a change to their DNA. In step 4, we see that promoters enhance the development of the cells. This means that the cells multiply, and they multiply, and they multiply, until they start to take over the organ. Remember that these cells are not the same cells that are normally within the organ. They're different, so they cannot function in the same way as the original cells. Lastly, in step 5, we see the malignant cells releasing into the bloodstream. They will travel through the bloodstream. This is called metastasis, and how cancer cells travel to other organs. We are exposed to carcinogens every single day. Free radical carcinogens are quenched with antioxidants. That's why I've been pressing for fruits, vegetables, and whole grains this semester. Other carcinogens, and those free radicals which are not quenched, can cause damage to the DNA. This happens quite often, but the body has an automatic repair mechanism. When the body cannot repair this, the cell self-destructs, or should. When it does not, the cancer process starts. One word on barbecues, or any frying that results in charred or blackened food. When you cook food to that crispy brown, this forms heterocyclic amines, which are carcinogenic. An additional risk to barbecuing is the drippings from the meat or sauce onto the hot coals or any hot surface, which then forms smoke and attaches to the meat, the black char of barbecued meat, yet again carcinogenic. So eat your fresh fruits and vegetables and whole grains. Don't char your food, exercise, and lose weight. These things will help protect you, but won't prevent cancer. And lastly, don't stress about it.